Good day po, sir. I am Resume S. Navarro, your student nurse for today. Okay, sir, for your verification, may I know your name?
I'm Shane Stephen P. Andre.
Okay, so when is your birthday?
June 6, 2001.
Okay, so how old are you?
I'm currently 21 years old.
Okay, so now I'm gonna be doing an assessment on your hair, skin, and nail. But is it okay to you to touch your certain parts of your body?
Okay.
Okay, but before we start with the assessment, I am going to ask you two questions. So, any history of skin cancer?
No.
Do you lay out in the sun or go to the tanning booth?
No.
Okay, alright, well, that's good. But when you do go out to the sun, do you wear sunscreen?
No, I don't.
Okay, alright. So, for your information, sir, it is important in preventing skin cancer to wear sunscreen when you do go out to the sun. Okay? Okay, sir, so rest assured that the documents and the results are completely confidential between me and the attending physician, which I will refer to you. Before we start with the assessment, I'm going to close the curtains for you to provide privacy. Okay, so can I request to remove your shirt and your jewelries you are wearing?
Okay.
So first, I'm going to sanitize my hands. And I'm going to wear gloves before the assessment. Okay, sir. So the first part of our assessment is I'm going to inspect your skin. So may I request you to stand up? So now I'm going to inspect your skin color, overall looking at your face, your chest, and your back. And what I'm looking for is, do I see anything abnormalities like cyanosis, which is the bluish discoloration of the skin, jaundice, the yellowish discoloration of the skin, the acanthosis nigricans, which is the poorly defined and the brown to black, and the velvety hyperpigmentation of the skin. Next is, I'm going to check your temperature. I'm gonna touch your upper and lower extremities of the skin. And as I see, your skin is warm and dry, your skin is smooth and thin, and that is normal, and that is very good. And the places we have thick skin is on the palm of our hands and the soles of our feet. Okay, sir, you may now sit again. So, now I'm gonna right here check your turgor and mobility. When I pinch the skin up, it should be moved easily. And it will be the normal mobility. And it should go right back to normal. And that will be the red vectus normal spot, and that would be the normal turgor. So mobility, turgor. Mobility, how does it move? And turgor, how does it go back to its position? So, as I observe and as what I am looking at your face and your chest and your back, I don't see anything abnormalities or any skin lesions. So, the next part for this assessment is I'm going to look at your hair. So, as I see your hair is color black and it's smooth, your hair distribution is symmetrical, and I don't see anything abnormalities in your hair. And now, what I do is I part the hair, then looking at the other side because maybe there's a sign of manifestation or any lesions or any abnormalities in the hair, which I do not see. And as I can see, everything looks completely normal and smooth and clean. Okay, sir, then the last part for this assessment is I'm going to look at your nails and fingers. So, to start with, what I'm looking for is that the nail bed should be pink and the nail shape is round. Some people have flat nails this way and people have a little bit rounded. And when I press on the nail bed, it should feel firm. It should not feel spongy, and also check for the profile sign. It should be 160 degrees or less, which I see it is normal. And I'm going to do the same on the other hands, and the nail bed should be pink, the nail shape should be rounded, and the profile sign is 160 or less. And now I'm going to do the same at your feet. So now I'm looking at your toenails, the beds of the toenails, the shapes, and the profile sign. It should be 160 degrees or less. And I don't see anything abnormalities. Okay, so Mr. Shane, before we finish this assessment, I just want you to give a tool that will help you to prevent any risk of skin cancer, which is the A, B, C, and D. So A stands for asymmetry. When the mole is symmetrical, that would be a concern. Next, B is for borders. If the mole is not smooth and irregular, that would be a concern. Next, C is for colors. If the mole does get a brown, black, blue, red, that would be a concern. And lastly is D is for diameter. If the mole is more than a half or inch or about an equal size of an eraser of a console, that would be a concern. So that's how it helps you to remember how to look your mole at your front, at your back, and when to contact your physician for follow-ups. So use A, B, C, and D. Understand?
I do. Thank you.
So any questions?
None.
So, and that concludes of our assessment for hair, skin, and nails.